Hi, everyone. Happy World Health Day. Today, we appreciate you joining us for our Wellness Wednesday program. I'm Kathy Poole.
And I'm Kaylin Harris.
Our goal of Wellness Wednesdays is to share information vital to your health and wellness. In support of this month's Patient Experience Week, today's guest is Shawn Howell, Director of Customer Experience at Nashville General Hospital.
Shawn Howell, or please excuse me, Nashville General's strategic goal is to achieve the Institute for Healthcare Improvement's Triple Aim. The Triple Aim framework focuses on population health, per capita costs, and experience of care. And it also serves as the foundation to successfully improve patient outcomes. Please feel free to ask any questions that you may have in the comment section below. So without further ado, I would like to introduce Mr. Shawn Howell.
Thanks, Kathy and Kaylin. Thank you so much. So before I dive right in and start talking about my topic today, which is compassionate connected care, I really want to kind of talk a little bit and give you some basics about suffering, because it's something that we really don't talk about. So suffering has many layers, it's very complex, but when it comes to patients, we can really look at it in terms of the sources of suffering. So there is inherent suffering, and then there is avoidable suffering. Inherent suffering really arises directly from a medical diagnosis or the treatment of the diagnosis requires. So for example, a patient with cancer may experience pain, appetite loss, skin problems, emotional distress due to their cancer diagnosis. Inherent suffering can also be from the treatment. So surgery, for instance, could be painful and frightening and the patient may need rehab because of their surgery. So even if healthcare was perfect, patients inevitably would suffer. And as caregivers, we may be able to mitigate suffering, but we can't eliminate it altogether. So that's inherent suffering. So avoidable suffering occurs because healthcare isn't perfect. During the course of a patient's diagnosis and treatment, if we make the patient wait, if we fail to work together as a team, if we don't provide an environment that is conducive to healing, we're imposing suffering on the very patient, on the very person who's come here for care. And then simply mitigating the avoidable suffering isn't enough. We must prevent it. So that's kind of the framework to kind of understand suffering. Try to mitigate it, try to prevent it the best we can, whether it's inherent or avoidable. So we can measure the extent to which we reduce patient suffering, and by understanding the degree which the suffering occurs, and then also understanding how we are able to measure that, look at it, and meet patients' needs so that we can reduce suffering. The framework for that is really looking at the totality of a patient's care experience. And that's what compassionate connected care is all about, looking at that framework, understanding our patients are suffering, measuring the suffering is just the beginning, but being able to embrace the totality of their patient experience is really what's most important. So compassionate connected care is clinical excellence, operational efficiency, culture, and caring behaviors. Those are the four domains of compassionate connected care. Clinical excellence really comes down to connecting the clinical excellence with outcomes. Operational efficiency, that's connecting efficiency with quality. Caring behaviors, that's connecting engagement with action. And then culture is connecting mission, vision, and values with engagement. Those are kind of the four domains of compassionate connected care. When a patient comes to the hospital and they have a care experience, so they're gonna come across clinical excellence, caring behaviors, obviously, operational efficiency, and culture. But they're also going to be impacted by empathy, and they're going to be impacted by engagement as well. And that engagement is as a staff, are we engaged? As a physician group, are we engaged? And then our patients also have to be engaged as well in this process. So it's those 4 domains, it's empathy, it's engagement. That's the totality of what a patient is impacted by when they come into the hospital. And it's up to us to really do better as a hospital going forward and how we can make that care experience better and reduce that suffering. So just to kind of give you an idea, I talk to patients all the time here at Nashville General Hospital, and I've talked to patients at other roles in other hospitals. And when you conduct an interview, you really want to get to the crux of what patients really feel that we should know as providers and caregivers when they come to the hospital. And one of those things that I like to share with anyone that when we talk about, compassionate connected care or any type of experience in the hospital, patients want you to know that they want their suffering acknowledged. They want you to know that they're in pain, they're anxious, they're worried, they're in pain. They really want you to acknowledge that. Patients also want you to know that body language matters. Everything you say, everything you do, every non-verbal communication is interpreted by patients and perceived by patients in a certain way. Patients also want us to know that they want their care coordinated. That is one of the top 5 things that patients say across the board in every survey across the country every year that patient experience programs do, is that they want coordinated care. We should allow patients to have a voice in their care, and that their care should be coordinated, and that we really shouldn't bounce them around, that they should come to one place and be cared for. One thing that I think that a lot of hospital staff and providers don't realize is that caring transcends diagnosis. Sometimes patients just want to hear a voice. They want to be cared for emotionally and spiritually. It's not always about the delivery of medical interventions. It's really about the care that they would like to get from us, and just sit down and talk to them or make them feel better. And then the last thing that patients have cited that they want to see is that autonomy reduces suffering. Autonomy reduces suffering. And that makes sense. If you've ever been a patient in the hospital yourself, or you've ever had a procedure or any type of treatment, autonomy helps you preserve your dignity when you're in the hospital. One of the things that we don't really talk about enough is what that patient brings with them to the hospital. They have a certain amount of anxiety, fear when they come to the hospital, and then they get here, and then immediately they're admitted. We throw a gown on them. We put them in a hospital room. We don't communicate very often or very much with them. So we have taken away pretty much all their privacy. We put them in a gown. We don't do a lot of communication. They feel isolated. They don't know what's going to happen next, who's going to come into the room next. Do we introduce ourselves? Do we talk to the patient? Do we let them know step by step what's going on? All those things impact the patient experience from the moment they walk through our doors. And making sure that we do those things to mitigate that suffering and communicate with our patients is really important. Lastly, let me just say that when we talk about the patient experience, I think people are under the impression that it's about making patients happy. And that is far from the truth. Patient experience is really about making sure that we communicate with patients, making sure that we provide an environment that is healing, making sure that they have a voice in their care, and making sure that we respect them. That's what patients are really looking for in that patient experience, that patient satisfaction. Being happy, it's a hospital. Let's be honest, it's a hospital. This is not a happy place. This is a healing place. And we want our patients to heal and get better. But if we're good at our jobs, we're good at those four domains I talked about: clinical excellence, operational efficiency, culture, and caring behaviors. If we are good at those things, and then we communicate, and then we respect, and then we get our patients involved in their care, then we've done the best job that we can, and they should have a positive patient experience. So I'm going to stop here and see if there's any questions that I can answer. I know I just threw a lot of material at you, but I'm very passionate about this topic because I love patient experience and taking care of patients. So
We definitely think it's important to focus on that compassionate connected care experience, which can lead to better clinical excellence, the operational efficiency. You talked about consumer loyalty and even our community reputation. But most importantly, why patients should have a voice in their care. Kaylin, have we received any questions?
So we have. So we actually had a patient or a past patient send in a question. So coming into the hospital can be very scary, even before the pandemic began. But this patient has said that they have connected with some wonderful staff members during their treatment. So with that being said, Shawn, what is the best way that they can recognize their team for their great work?
So I always tell patients the best way. I mean, sometimes I will get phone calls from patients saying they want to give kudos and give thanks to their caregivers, but I always recommend that you write a letter or note and send that directly to the caregiver and the caregiver, the unit that they worked in and the floor that they worked on, and be very specific about who you really want to you want to say thank you to. It's really important. They don't get enough of that. I will tell you that I've worked for many hospitals and staff don't get enough recognition. It's great if I come to say, you guys did a great job, but it's even better if they hear it directly from the patient. So I say, grab a note card, write a very nice note or letter to that caregiver that took such great care of you.
That was great. That was a great question. Thank you, Shawn.
And then there's also the survey forms patients receive after they've actually been to the doctor, were seen in the emergency room, or even an inpatient at the hospital. What is the importance of those surveys? Can we talk a little bit about that?
Yeah, so those surveys are actually called Hcap surveys, and they're hospital consumer assessment surveys. They are required by the government. Every hospital in the country does some type of CAPS survey. Those surveys are used to really assess how we are doing as far as the patient experience. There are financial penalties involved if hospitals don't excel as far as their Hcap surveys. And there are also rewards as well if you do well on Hcap surveys. Those surveys allow us not only to be graded on how we are doing as far as the patient experience, but those surveys also allow us to assess how we are doing and improve. How would I know as a director of customer experience if we were doing better, if we were improving, unless I got some feedback from our consumers? So those surveys are extremely important. That data that we get back from the surveys is important. It helps me help our nursing units in our clinics improve and get better with patient experience. And it gives us a roadmap of where to go, where we need to excel, where we're doing well, where we need to improve. So that information from those surveys is vital.
And we did have a question come in through Facebook. Is patient experience a concept only for clinical staff?
That is a really good question. So no, it's not just clinical staff. I've gone back to my 4 domains of compassionate connected care. Operational efficiency, how we operate as an organization is extremely important from the top down. From our CEO to our COO to our chiefs and our directors and managers, it's really about how we operate as an entity, as an operational team to make sure things run smoothly. I gave you the example of, kind of that avoidable suffering, long lines waiting for your MRI for an hour, or, sitting in the registration area for an hour and a half. That's not good for patients either. It's not clinical, but it's operational. So yes, it's not just clinical, it's operational as well.
Perfect. Thank you, Shawn. Thank you
You're
very
welcome.
much. Well, that is all the time that we have today. Thank you to everyone that joined us this afternoon, as well as Mr. Shawn Howell. We really appreciate the discussion.
Thank you.
If you have any questions at all or want to speak with Shawn directly, please leave a comment below or feel free to contact him at shawn.howell@nashvilleha.org, shawn.howell@nashvilleha.org, or 615-341-4241. Again, that number is 615-341-4241. And I will also put his contact information in the comments below.
Don't forget to mark your calendars for a very important Wellness Wednesday event on Wednesday, April 21st at 12:15. We will have Pam Cruz, an advanced practice nurse practitioner who leads our medical legal exam team here at Nashville General Hospital. April is Sexual Assault Awareness Month, and Nashville General Hospital's MLE team are experts in treating survivors of sexual assault. 30 years ago, Nashville General realized a community need for experts in this field, and the medical legal exam team was formed. It provides care to victims ages 16 and up. Please join us for this very important session. Bye.
Bye. Have a great day.